This is a critical care hospital, cardiac hospital. It's a tertiary care destination, so we see the most complex patients with some of the most complex surgical pathology.
This program cares about teaching. I feel like this is a facility where patients get excellent care. I feel like all the physicians and staff that work here are very good at what they do, and I think this is a great environment for residents to learn.
I think that this program is different than a lot of other bigger academic programs. We have, obviously it's smaller. I think you have more one-on-one communication with attendings. It's much more like a family. I don't think you're going to get lost in the shuffle. The complexity and diversity of our patient population really, I think, tends to offer itself to train our residents really, really well. This speaks to the fact that, our first graduating chief class, all three of them got the fellowships that they wanted.
Surgery is a unique discipline. It requires unique individuals. I consider surgery the tip of the spear, if you will, at this hospital, and the residents have to respond to that. They have to walk into a room with a sick patient or from a referring doctor and instill confidence in both the patient and the referring doctor that patient's going to be taken care of.
I think the nice part about working with residents is there's always somebody challenging you. There's always somebody who it's their first time. And so especially when I am in such a relatively small focused area of surgery like endocrine surgery, something that helps prevent repetitiveness and the mundane aspect is I get a new resident that comes in and it gets to all be done over again. I get to go back through things. I get to explore what's interesting to them, guide them, mentor them from that part of it.
I think the residents give us a vitality, give us an energy that after being in practice for a couple decades is useful. They keep us fresh, they keep us accountable for sure, and I love the energy that they bring.
We have the residents come to our clinics and, frankly, I just have them dive in. I often have the residents present their findings of the history and exam to me, not outside in the hall, but in the room with the patient. So the patients hear that. They hear the discussion about what are the issues, what are the options, and I think that educates not only the resident, but it also helps to educate and make for a better informed patient.
I want them to become critical thinkers. I want to give them the toolbox to be able to take care of any problem or any patient that they see. I want them to be good leaders. I want them to be respectful of their peers and other colleagues. And I want them to be self-directed learners.
I try to give residents as much autonomy as I can and they are willing to assume. I make a conscious effort to encourage them to make important decisions for their patients in and out of the operating room, and I think they understand the responsibility and the high expectations that go along with that.
Looking back on my training, there was a lot of what we would call scut work, transferring patients, drawing labs, kind of doing those types of things, which was fine. But here, the residents are operating much earlier. They're more interactive with the attendings, talking with them directly opposed to going through layers of other trainees.
The residents are heavily integrated into my practice. Sometimes I tell my patients, if you're seeing my resident, you're seeing me.
One of our rotations includes a rotation down our Midtown Hospital, and we're very excited about its renovation. St. Thomas Midtown is transforming from a large general hospital to a set of boutique specialized centers designed by patients and physicians precisely to serve the patient's unique needs.
Nashville is one of the fastest growing cities in the United States. It is home to incredible restaurants. It's also known for our live music, and it's not just country music. Nashville is also home to major and minor league sports teams, including the Tennessee Titans, the Nashville Predators, minor league baseball team, the Nashville Sounds, and our newly added MLS team, the Nashville Soccer Club.
I think the unique thing about this program where candidates should choose our program or would be happy here is the camaraderie of the residents. This team, I've been associated with many resident teams throughout my career, and the teamwork that these individuals display is one of the highlights of the program.